Hi, everyone, and welcome. My name is Zach. I'm the marketing communications manager here at Edge, and I'll be your monitor or moderator for today's Edge webinar. We're so glad you could join us for Show Me the Numbers, Unlocking Growth Through KPIs and Dental Hygiene. This is going to be a fantastic session, and we couldn't have a better guide to lead us through it. Our speaker today is someone who truly brings brains, hearts, and a great sense of humor to everything she does. She's a sought-after speaker, best-selling author, and a lifelong advocate for joy and wellness in dentistry. With nearly 20 years in private practice, she blends clinical know-how with a gift for making science simple, actionable, and transformative. Brandi Hooker Evans is the founder of Stellar Outcomes, co-owner of Evans Dental, and an accredited provider of continuing education. She holds a master's degree in health education from Idaho State University and uses the foundation to empower dental professionals with meaningful real-world strategies. In short, Brandi is the person you want in your corner. Whether you're looking to grow in your career, spark a little joy in your workday, or just be reminded to keep chasing what sets your soul on fire. So without further ado, please join me in welcoming our speaker, Brandi Hooker Evans.
Well, hello everyone. Zach, can you see my screen well?
Yes.
Okay, perfect. So, may I ask a favor? Will everyone that's joined us please put down your pens, your paper, calculators, your digital note takers, whatever you have out for this course, just for a quick minute? Okay, maybe I have a couple of favors. Will you also then now close your eyes down and ask yourself, why did you become a dental professional? Maybe you're a dentist, a dental hygienist, perhaps the administrative tasks are what you tend to. Or maybe you're a dental assistant that is holding the office together like the best glue ever. Think back to why you chose this profession. And if your answer was the money and the great schedule, I'm assuming everyone's learned by now that, haha, that's not exactly how it goes. The short answer for me is I wanted to help people. And unlike some of our other healthcare professional sisters and brothers, I thought the mouth was a great orifice to choose from and a little less sketchy than some. So now that you're here and you have your why, I would like for you to just keep it close as we spend the next few minutes together. And I want to share that this session is brought to you by Edge. I've partnered with them because they love to make sure that the workday is great for the professionals as well as the patients. And as you all know, it has to be great for both of us in order for us all to thrive. So hang on to your why and let's just dive right in. So go ahead and grab those pens and papers and calculators out. And I am going to have you jot down how many patients have you had that were active in the last 12 months. Just do a rough estimate. Fact is, if you want to, put it in the chat. How many active patients do you think you've had in the last 12 months? Okay, now that you have that number, you're going to then write how many times the codes for periodontal therapy or periodontal maintenance were used. And you can see on this screen, those are the 4341, 4342, and 4910. And so what you do is you take the total number of patients that were active that saw a hygienist in your practice, and you divide that by the number of people that had periodontal therapy. In this example that we're using today, we have 10%, right? Out of 3,000 patients, there were 300 people, and that means that only 10% of patients received periodontal therapy. Now, what's super interesting about that number is that 47.2% to 70.1% of the American adult population were found to have mild, moderate, or advanced bone loss after the age of 30. So we're talking half to three-quarters of the population have periodontal disease. I would love to know from you in the chat, these numbers that are now 12 years old, this is from 2013, from the CDC and the ADA. Do you think our patients now, 12 years later, have more disease or less disease? Okay, so we've got the practice, we've got active patients versus perio patients. We found that we have 10% of the patients that have periodontal, or excuse me, that are seeing the hygienists for periodontal therapy of some kind. And we know that half to three-quarters of the population, so it's 47.2 age 30 and above, and then at age 65, that number jumps to 70.1%. Now, we've got in our mind a couple of these numbers and we flip to 85.6% of all dental hygiene codes are prophylaxis. So what do you think? Are we meeting the needs of our patients? And I know without a doubt that most, if not all of you here in this room are like me and you want to help people. You want to know how you can do the very best for your team and your patients so everyone gets really high quality dental care. And so, why is this happening? What exactly is going on here? And it's really quite simple and can be explained by my friend Aggie. Aggie is a cow who loves apples and graham crackers, and she loves to be hand fed. This many 100-pound cow is so sweet and so loving, and she has a whole pack of sisters. And I spend time feeding them with my friend that has this farm, and these cows are so wonderful and they are fun, and you can be in the pen behind the barbed wire, behind the hot wire fence, feeding them by hand, petting them. They like to get scratched with a rake. And because they have been treated individually, they do not behave like regular cattle. Now, in the dental office, we're doing the same thing. We, instead of treating each person individually, we are just herding them through like cattle. We have an 8 o'clock prophy, a 9 o'clock prophy, 10, 11, 12. And so we see that on our schedule. And all day long, we're trying to fit every single person into this prophy stall, and it's just not working. Because what you and I all know right now, any of you that are taking insurance know that the reimbursement rate on the prophy is low enough that a lot of times we're even losing money when we're providing that prophylaxis. Now, I love a prophy. If you need a prophy, super fun. I love to enjoy chit chat and all of the pieces and parts of that part of my job as a dental hygienist, but it's not necessarily where I'm making the most positive impact for my patients. And this goes for nationwide. What I have seen in my last 11 years of coaching and teaching continuing education is that most offices are operating their periodontal program at well below 10%. And you can imagine that if you love your patients and you want the very best for them and they have disease, but they don't know that they have disease, or they have disease and it wasn't presented in a way that they want to treat it, oh, you can see the gap there, right? It's a big disparity between what the patient needs, knows, and what they're attaining. So we want to make sure that rather than hurting our patients like cattle, that we are in fact treating them individually. Now, I'm not suggesting that you show up as a dentist, a hygienist, or the front office and ask your patients if they would like to eat graham crackers and apples straight out of your hand. But I am saying that if we treat them like a brand new case every single time. We are going to figure out what they need and be able to take care of them in a most profound way. So put your boots on. We're gonna roll up our sleeves and figure out how to do this. Now, if you thought that you could tune out because you're not a dental hygienist, here's where I'm going to invite you back in to join us for the afternoon because actually, what I have found is when we are looking at the hygiene department, it is completely unsuccessful without the aid of the rest of our team. And it's been interesting to watch teams that I've worked with over the years. By the end of our time together, frequently the assistants and the administrative team are coaching the hygienists about how to get to this goal that we're hoping for. So it really takes the entire team. Now, dentists and hygienists, I want to encourage you that you're not just a team, you are the A team. We want to co-diagnose with one another as well as our patients. So there's some non-negotiables in order to make this come to life. By the time we get done today, I know we have a very short amount of time, but you're going to have everything that you need to take this back to your team and really watch the key performance indicators that make the biggest improvement in your entire practice. So dentists and hygienists, I am going to encourage you very strongly to work together. This is our chance to link arms with the patients and get them to make the decision for themselves. Because what we want to see is once we get done with assessment, our patient should then be able to tell us their status, whether or not they have disease or health. So if we show up and are arguing or not on the same page, or you can feel the tension in the office, none of this will work. So that's why making time to tell your team good morning, sit down and look at x-rays with your dentist and hygienist and the assistants and administrative tasks or administrative workers as well is so critical to the success of the entire program. And what I want to reiterate is when the patient doesn't know what to do about a situation, they always will ask the assistant. And the assistant is the one that often feels more on the patient's team in a lot of offices, not every office, but if they are educated in a way that they can help reinforce this information, it's going to change everything. And not just in the hygiene room, also in the restorative room as well. And then when your patient goes home and forgets all the things that you talked about, they call and who answers the phone, right? So every part of the team needs to be on board and understanding that when we're looking at this key performance indicator, how to evaluate it, why it's so important, what we're doing about it, and what we can expect the outcomes to be in each given situation. Okay, I could stick on teamwork for a while, but we're going to keep moving on. So again, the entire team, whether you're front office or back office, there are 5 things that we need to not assume. The big 5 of assessment. There is a cute little donkey on this picture to remind you about the old adage, what happens to you and me when you assume. I'm going to leave it there. You do what you will with that. But we have to commit to a medical history, a blood pressure reading for every patient every time, an oral cancer screening, appropriate radiographs, and a periodontal chart, full mouth perio chart every time. And I just want to have everyone take a deep breath, breathe it in. I know that that sounds like a tall order, but I'm going to show you why these 5 things are so critical to every outcome that you want to see from now on in the rest of your dental practice, not just in your hygiene program. Okay, so the first one is a blood pressure reading. Many of our patients only see the dentist every year. So 1/3 of the American population goes to see their doctor 1 time per year, but 2/3 of the American population goes to see their dentist. So we really are the most seen healthcare professional across the board. Obviously, that changes in different demographics, but as a broad statement, people are coming to the dentist more often than they're going to the doctor. And many people do not go and understand what's going on in their body until something is wrong. You and I both know that teeth don't hurt until there's a major problem, gums don't hurt until there's a major problem. And the same goes for cardiovascular disease, thyroid disease. You start looking at all of the autoimmune diseases, and they are occurring decades before we're actually seeing them come to life. And then what we know about heart disease and gum disease is that they're very related. They can help each other or hinder one another. So if someone gets a high blood pressure reading, I'm already linking arms with the patient and showing them that I care about more than just this, right? I want to care for the whole, not just the whole. And as you can see, these bacteria that have been known to cause periodontal disease and be active while the disease is working, we're actually finding in the clogged arteries of patients that have died from cardiovascular events. So this is big information, folks. And I've heard it said before, oh, it's not like we're saving lives. And my friends, if the bacteria that started in the mouth are then found in the clogged arteries of patients that we loved and have lost, I respectfully disagree. We are saving and changing lives. So, uh, every single appointment for an adult, take a blood pressure. And if you don't already have a cuff, you can hop on Amazon. These are the approximate prices for what you can have them shipped to your office in 2 days' time for no shipping for most of our Amazon users. And if you want to be nostalgic, you can go to your school box and get out your old school sphygmomanometer and take blood pressure by hand, which is definitely the most accurate, but this works well because while you're doing the medical history update, you can take the blood pressure, have the patient relax, and be taking care of this at the same time. What we're trying to do when we move from the medical history to the blood pressure, then to the oral cancer screening, is to show our patient that we are with them and for them and next to them. We're not above them. And we know that early detection saves lives. And as we're progressing through this 5-step assessment process, we want to make sure that we aren't using words that the patients don't understand. So, for example, if you talk about a mesial buccal filling need, the patient is going to zone out. But if you point to the exact tooth and say, do you see this front cheek side part of your tooth? They can understand that. And it's a, a lot of professionals, I think, use our lingo because they want to sound smart, but I would say that we don't sound smart, we just lose our audience. So ditch the dental lingo and continue on this journey where we have now completed the oral cancer screening, a medical history, and we want to know not just are there any medical history updates? We want to know, are you taking any medications? I've worked clinically a ton this summer, and my patients that are taking medications in the past, almost every single time need to update those. They're not taking what they were, they're added new things, they've been able to delete all of them. And that's really critical. What do 80% of all medications cause? Yeah, beat you to the chat, right? Dry mouth. And then what does dry mouth cause? It makes you at a higher risk for cavities and periodontal disease. So you guys can see that this is all blending together. And we want the entire team to be able to understand what's going on so that no matter who the patient is talking to, they're getting the same, we love you, we care about you, these are simple terms, this is what's going on for you. So in oral cancer screening, this is my beautiful friend Liz. She is here today because thyroid cancer was caught early for her. So I never want to be the person to find oral cancer, and I certainly do not want to be the one that missed it. So again, 90 seconds, folks, extraoral, intraoral. And in my office, we make sure that both the hygienist and the dentist are taking a look around because why? 4 eyes are better than two every single time. And it's not a competition, it's a collaboration. And what I love about all of this, I'll just do a little spoiler alert, is when you start practicing with your team, you talk to the front office about periodontal disease and why we care and how this works. And you give the assistants the tools they need to explain it simply so that everyone is on the same page. You, you just become such a family at the office that when you get done with the day, no matter how hard the day was, you leave feeling fabulous. So anyway, that is part of the excitement there. So moving right along, the next step is a full mouth periodontal chart. Now, I know I know there's a little kickback sometimes about we don't have time for this. We only need to do this once a year. And I'm just going to call it like I see it, folks. If we do not know if there's bleeding or no bleeding today, then we don't know how to guide our patient. If the patient has no bleeding upon probing, if their entire sulcular square footage inside of their mouth is intact, then they need a good job. This looks great. Your gums are healthy. And what's happening for those patients? So, if their skin is intact, right, their gums are just like our hands. If there's bleeding on your hands and you wash your hands, you know something's wrong. So, if there's bleeding on our gums, we know that something is wrong. In our case, it's infection and periodontal disease, whether it be periodontitis or gingivitis. But either way, if they have gingivitis, we want to prevent them from having bone loss. So it's a big deal that they're bleeding upon probing today. And likewise, if they are bleeding and have bone loss, then we know that we now can't prevent this disease. We've got to treat it. So this is why we just can't negotiate. And what I have found is that in health, this entire 5-step process takes less than 20 minutes, which then leaves you 25 minutes to scale, ultrasonic, polish all your favorite things, and then 15 minutes for an exam and a really high quality dismissal. We'll see you next time. So if you've got a prophy appointment and the patient needs a prophy, this entire process is very, very quick. I mean, if you're not a hygienist, just to give you a heads up, you can probe the whole mouth, and I always make sure to have an assistant present. And if I don't, I still call the numbers out loud. But it takes 2 minutes to do the entire mouth if there's nothing to find, right? If we're 3, 2, 3, 2, 1, 2, bam, it's done. The patient high five, you can stop talking about dental hygiene. But rather, if you lay the patient back and you tell them right from the beginning that 1 to 3 millimeters is normal and healthy gums don't bleed or hurt while I measure, the patient knows. They can understand 1 to 3 millimeters is normal and healthy gums don't bleed while I hurt or measure. So now, as I'm calling out the numbers, if I say 4, 5, 6, 7, any of those, my patient's eyes are going to get big. They're going to be like, uh-oh, did you say 7? And you're going to say, oh, yes, I did say 7. Let's keep looking. And when you say they don't hurt or bleed while I measure, that takes out the, well, they were fine until you started stabbing me with that instrument. Now, for my hygienist and my dentist here that are present with us today, I do want to encourage you to remember that the epithelial attachment, where the bone and the tooth and the gum connect, I close my eyes a lot because, and hopefully my patients aren't watching me, right? But we should know what it looks and feels like, and we want to be gently bouncing along the epithelial attachment. And those collagen fibers are bouncy when they're intact, and when they're diseased, they won't be, and it will feel different. But even when there's disease present, we want to gently be reaching the epithelial attachment wherever we'll be, not puncturing our own holes. So just keep that in mind as we move along. All right, so my favorite part. I know you were like, Brandi, but I thought your favorite part was going to be the perio chart. And I'm telling you folks, no. My favorite part and what I needed in school was how to read x-rays. Y'all, I graduated dental hygiene school without being able to properly read x-rays of any kind. Um, I would look at them, and if there was a gaping hole, I could tell what was happening. but I definitely couldn't describe what was happening to my patient in less than a 3 paragraph format that included a lot of vocabulary that I'm not sure that I knew what it all meant. But I learned this trick and I hope that you already have it, but if you don't, here it is. This thick white line should go down, over, and up in between every tooth. Like so exciting, right? You know, you're getting your Valley Girl out ready to pom-pom cheer that because yes, that is so true. What is that thick white line? That thick white line is the lamina dura. Do our patients need to know that? No. What do they need to know? That is the thick bone that protects the bone on the inside. We need that thick bone to protect the other bone because the other bone is where the new cells are being made, right? So exciting. All of the uh, just the amazing histology that's happening in our cancellous bone is fabulous. And what happens when there's infection present, that outer bone knows that its job is to protect the inner bone. So it actually tries to get away from the infection. You and I know that super sucks because now the bone is receding away from where we want it to be, but they are protecting the little baby cells that are going to go out and be anything that we need them to be coming up. So we need that thick white line to go down, over, and up, unless we're on the mandible, up, over, and down. So you can see on this picture, if you're on your phone, this will be a little bit difficult, but I'm gonna just show you this thick white line is coming down along the distal of 12, thick. I mean, look at that. We've got 2.5, maybe 3 millimeters of bone in between, in approximately, and then up along the mesial of 13. Whereas, hang with me, do you see how this thick white line comes down? And then look, folks, right here, that whole triangular shaped notch of a widened PDL. And then you can see that the lamina dura comes down, has a teeny tiny little point. The entire space interproximally still has the height there, but I mean, just give a thumbs up if you can see the difference on that picture. Can you see what I'm looking at? Why this is definitely not a healthy spot of bone. Now we can go to the next slide. Check it out. We got this thick bone, and then can y'all see how it's so gray and fuzzy right there? Do you see all that? You guys, this is active periodontal disease. And same thing over here. Now, the angle of this, we've got a more straight on view from the mesial, but when we go back more posteriorly, that's a hard word. Say it 5 times fast. If anyone needs like Starbucks, say it out loud, send it to me. I'll email you a treat. Uh, but as we look, it's harder to see where, because it's not as straight on a picture, but you can still evaluate this x-ray with the patient. And you can say, we don't have any thick white line. So look in between 14 and 15. Can you guys see that we have lost so much density? Now, 30 to 50% of the density of the bone is gone before we can see it on the x-rays. So that is why it is so important when we see widened PDLs and crestal bone density to show our patients this is what this is. Okay, so now you've been with me. We've done medical history update. We don't want to say, are there any changes? Have you had surgery? Have you had any kind of a medical event? What medications are you taking? Then we take their blood pressure. Is it outside of the range of normal? When they're like, why are you taking my blood pressure? I am a great screener in your life for any and all troubles. The sooner that we catch them, the better they are. And gum disease and heart disease are related. So they will help or hinder one another. Someone's on blood pressure medication and you say that, they're like, oh, light bulb. And then we move to the oral cancer screening, full mouth perio chart, and the x-rays. Along the way, we've been talking to our patient like they are our equal. They're not our patient that we're talking down to. We have hooked arms with them and we have said, this is normal, 120/80 or less. 1 to 3 millimeters is normal and healthy gums don't bleed or hurt while I measure. This thick white line should go down, over, and up. So we get to the end of assessment, and here is the most difficult part. Is anyone else sweating for me? You guys, this is the hardest part for me. I love to chit chat. I love to know what people think. I like to turn it into the problems of the universe, solving the problems of the world. And I'm so excited because at this point in the journey, I know and I know this for half to three-quarters of my patients. And we discussed earlier that those old numbers from 2013 are probably underestimating it, right? Ever since, especially COVID, we've watched inflammation just burgeon out of its coat, as it were. And so we get through the 5 steps of assessment and we just are quiet. Why? Why are we quiet? Well, we have to let them choose for themselves, right? The next thing that happens is absolute fireworks because we sit the patient up and we wait for it. And the patient says, well, what are we going to do? And then it's, yay, yes, ta-da, like, yes, this is perfect. What are we going to do? And the answer is, right, we're going to treat this periodontal disease. This is so very exciting because we did not have to do case presentation. I am guessing that whether you are front office or back office, collectively in this room, we have done thousands of hours on continuing education for case presentation. Guess what we don't have to do anymore? None of that. And can you see if you show your patient, let's go back to these x-rays. If you say this thick white line of lamina dura, what also does that count for? That thick white line is the enamel. So now when we're doing the restorative part of the exam, which hygienists, please be taking notes. If you see a cavity, share that with the doctor. Let them know. And if you see something on the x-rays, obviously you're not going to say 2 needs an MOD. But what you are going to do as we're looking at that lamina dura is back down here on the enamel, we're going to say this thick white line of enamel should go down, over, and up between every tooth. Do you see this V-shaped or U-shaped notch that's fuzzy? And your patient is going to say, oh, yeah. And you say, that's what it looks like when the tooth is losing its strength. Just like this picture. This is what it looks like when the bone that's holding your teeth into your face, this is what it looks like when it's losing its strength. And I always love to show them a tooth or a uh, periodontal bone area that is healthy in their own mouth. The reason why we're showing them in their own mouth is because they don't care about the charts, y'all. They just don't. They want to know what's in it for them, what's happening to their own skin and bones, pun intended. This is where they are trying to figure out if they can understand what it is that we're saying. And so if we keep it simple, take them through this process. And obviously, folks, this whole process takes longer if your patient doesn't need a prophy, which is so cool because, and we'll find out some numbers in just a minute, but if your patient doesn't need a prophy, then you're not going to use your chair time for a prophy. You're going to do something that's quite a bit more profitable for half to three-quarters of the population. All right. So we're going to use the keep it simple, stupid rule, KISS, or keep it simple, sunshine. It depends on how proper you are. To me, it depends on the day if I'm proper or not. So um, what we want to know is there bleeding and is there bone loss? Because if there's no bleeding, here is your take home. If you're the front office team, this is what you're going to tell your hygienist. If there's no bleeding, their job is to high five the patient. And when you send their prophy to the insurance company, they're going to pay it back and be like, whoop, yep, good. Everyone's on the same page. Now, if there is bleeding, then we have to say there is active infection. Our next question to ourselves is there bone loss? So if there is bleeding and no bone loss, then we know that the patient still needs a prophylaxis because we're preventing the disease. We're preventing permanent damage. We're preventing what would be next, right? So if that's the case, then we're still going to do a prophylaxis today, but we're going to have them back in a shorter amount of time if we truly want to prevent. In which case, we're going to say, if they have insurance, let's just pretend like you take insurance and they have insurance and we're on that. You say, Your insurance is going to likely not help you with this additional preventive cleaning. However, if you were my sister, I would not want to just stand around and wait and watch you grow periodontal disease. Okay. So you do the prophy, you have them back. We know that it takes 3 months for the bacteria that cause permanent damage to repopulate. So when would we want our patients back? In 3 months, it's going to be out of pocket for them, which, for your folks that like to get pedicures, just, it's a couple of times eating out or it's a couple of pedicures. You compare it to something that is important to them already, and then you can manage the financial conversation that way. Now, let's say that they do have bleeding and they do have bone loss. What do we do? Well, periodontal therapy, right? We are going to treat the disease. We're going to count up the number of teeth in each quarter of the mouth, and we're going to treat the disease. It's so cool. Now, the number one mistake, I'm going to just call it like it is. I'm not judging you. Maybe you've done this because for sure I have, and I've just forgiven myself for it. But I used to threaten people and say, "Oh gosh, if this doesn't get better, we're gonna have to do periodontal therapy or scaling and root planing or deep cleaning, whatever verbiage is politically correct at the moment." I think right now, just for all of you that were wondering, I think the correct politically uh, assimilated term is periodontal therapy because we are not trying to remove the cementum. So anyway, I digress. We can save that for another day. But we want to share with our patient when they do have bleeding and bone loss, right? Keep it simple. There's no gray area here. Is there bleeding and bone loss? If so, yes. Then we are going to celebrate. So we've taken our patient on this really cool journey through assessment where they decided that they had their own gum disease. You now, as a doctor and a hygienist and an administrative team and assistants, no longer have to do case presentation. This is so, so cool. And, you know, you can tell me, I just light up. This is so geeky, it's so fun. So it's not a sad day. And our patients are going to ask us. I would say, as this happens, about 2 out of every 100 patients are going to be like, yeah, I just don't really care. But if it's been guided in this fashion with your own personality, if you're bubbly, be bubbly. If you're sarcastic, be sarcastic. You do you. Guide them through assessment in this way. Your patients are going to ask you what to do. And then the best answer that we can give them is options. We're going to give them good, better, and best. And doing nothing is always an option, and then offering them everything in between doing nothing and ideal. And this is where the conversation can be so effective when you say, if you were my mom, this is what I would do for you. Or my favorite uncle was in last week. That's one I've used a lot of times because I get to see my favorite uncle, right? Or for my son, we did this. So whether you're doing fillings, crowns, full mouth reconstruction, periodontal therapy, look at the patient eye to eye, elbow to elbow, belly button to belly button, and say, this is what I would do if you were my favorite auntie. It makes all the difference in the world. Uh, and not just for the patient. The patient trusts you, but then they also get to be someone in your life that you can tell are making a positive impact. We just talked about this in my team meeting yesterday. There's nothing worse than being talked over. You're getting a filling or a cleaning done, and the dentist and the hygienist and the assistant are talking amongst themselves and not involving you at all. That really makes you feel like cattle that's being herded in and herded out. And we can delete that with a few of these things. Okay, so um, I want to make a preface that if you adopt this program because you want to make money, it's just going to fall on its face. If you adopt this program because you know that your patients have disease and you want to encourage them to be on their own journey to wellness, because if we tell them, they may or may not, and they won't do it long term. But if they tell themselves, Now we're cooking, folks. Now they're invested. Now they want to do something to make a change. So let's put our business hat back on because many of us in here own a business and think about this. One pro fee is usually scheduled for 1 hour of hygiene time. That is roughly $100 of production. Go ahead and populate in the chat. How much is a pro fee in your office? Let's make the numbers simple and say that it's $100 for our intents and purposes today. But we do the assessment and our patients actually have periodontal disease. So now we're going to need a total of 3 hours. Again, I'm just rounding and doing regular estimates. Our 3 hours now, instead of being $100 of production per hour, are now $333 because let's say that a quadrant of scaling and root planing or periodontal therapy is $250. Most offices, it is comparable to a two-surface filling. So when we're describing this to the patient, you say something like, "Oh, this is very similar to having a cavity in each quarter of your mouth," right? And if they have insurance, you do that spiel, and if they don't, they still understand what it's like to have four cavities. This is the same thing, folks, and at roughly the same price. But if we're doing periodontal therapy for half to three-quarters of our patients, depending on their age, not their demographic and socioeconomic status, which is shocking, isn't it? That is across the board, the level of disease in epidemiology. So now our hygiene chair, instead of being worth $100 an hour, is now worth $333 an hour. Do you guys see how this triples your hygiene production? And really, you only have to see a couple of patients with periodontal needs to have them have your whole hygiene operation be so much more lucrative. And again, I cannot emphasize enough. If you're going to do this for the money, this whole plan is going to fall on the face and people are going to get the ick factor from you. But if you as the administrator or the dentist or the hygienist or the assistant think, "Oh my goodness, periodontal disease is linked to every single other disease in the entire body. Plus, I don't want to sit next to that person on the plane with that smell. I want to help them get better." If you want to help your patients get better, it's so cool because the way that we're going to be able to indicate whether or not our performance is serving the population that we love so much, it's going to be by our numbers. All right. So one thing to note is that dentists, hygienists, and assistants, we always want to drop our patients off at the front desk. I'm going to share with you, please don't. Please acknowledge to the patient that this is going to be similar financially to having a cavity in each quarter of your mouth. You don't have to give them the specifics of their insurance. You don't have to tell them their exact estimate, but acknowledge the fact that this disease is going to require our resources, which is time, money, energy, right, to manage. It just is. And if you tell them and they're not surprised when they go up front to chit chat with Aubrey on the way out, they're not going to change their mind about care. They still diagnose their own gum disease or what? Their own cavities, their own need for a crown replacement, all those things. Since they're invested here and they've been gifted the opportunity to know the resources it's going to take, now as they go and have that in-depth financial discussion, they're not worried about, "Oh, was Brandi lying? Was she just on a kick? Oh, is this a money grab?" No, because we've been acting out of heart the entire time. And we know, here's a great statistic for you. This is the last several years of how much people spent on their pets. Folks, people have time, money, energy, and love for the things that they care about. It's our job as the dental professional team to show them, to link arms with them, to get them to diagnose their own disease and encourage them to care about their own health and wellness. Oh, before we go on, I just wanted to say, you guys, $150.6 billion last year from pet care. Wow. That is incredible. So, according to dental economics, 75% of all restorative needs are diagnosed in the dental hygiene chair. So not only are 90% of patients spending 90% of their time with hygienists, 75% of the care that is happening in the restorative room is coming from the hygiene room. So, my invitation to every single one of us in this room is to take our patients with us on a journey that blesses them with their own autonomy. Let them make their own decisions and look at the numbers to measure how much of your patient population are getting the care that they need. I believe with my whole soul that we can make such a positive difference, not only in our patient's mouth, but in their entire well being. For them to be seen and heard and encouraged to live an anti inflammatory lifestyle, to take care of their bodies and their mouths in a way that they never thought possible, that deletes the need for lecturing, that deletes the need for eye rolls and cattle herding, that not only will our patients be better, but our career satisfaction in living into our purpose will go off the roof or through the roof. So uh, it starts with us. It really starts in our operatories and how we run our practices, how supported our teams feel, and how we show up day after day. So if you're wondering where to start taking back your time and your focus. Find the help that you need. Companies like Edge exist to support your practices. There's a lot of great resources out there to help you on your journey. So take advantage of as many of them as you can. And for the last quarter of an hour, we're going to open it up for questions, comments, concerns, and I'm so honored to be on your team. Thank you guys for making this the best profession possible. And I love what we do. We're changing lives. I see it in my patients all the time. I know y'all have seen it in your patients, and I really believe that if you can if you can adopt this, if you can give your patients their own choices, it's going to change everything. And coincidentally, your KPIs are going to look beautiful and not just in the hygienist department, in the entire team, with only working on one aspect of your practice. So, Zach, thank you.
Yes.
Thank you for letting me hop on and share how one little thing can make such a big difference.
No, thank you. We really appreciate you taking the time to speak with us. It was so great. Yeah, so we like to turn this time over, see if there's any questions in the chat. Open this up to all the people here. Let us know if you have any questions.
Yeah, it looks like Abdul is the 120 for your prophy. Is that how much it costs in your practice in Indiana? I'm super interested because I've seen the reimbursements nationwide be quite different. Okay, well that's great. I think that a prophy is absolutely worth 120. What's your reimbursement like? Or are you not taking insurance? Yeah, yeah. Are you finding that sometimes the hygiene appointments when they're prophies are coming up in the red? Oh, you work at a corporate office. Okay, what's so great, Zach, about corporate offices is they have figured out how to really lower the overhead. And that makes a huge difference because to provide a prophy appointment or periodontal therapy, it costs quite a lot in resources when we look at the sundries and the equipment needed, plus the hygiene. Uh, hygiene wage. And then Abdul, you say that you prefer patients don't pay out of pocket for that. Yeah. Yeah. Well, they've worked. So this is one of the things that's so near and dear to me when people say I want my free cleaning or they talk about their free insurance benefit. I always reiterate that, gosh, this benefit that you have is something that you've worked really hard for, or whoever the policy holder is. Maybe it's your dad or your husband or your mom, it doesn't matter. But we really want to highlight to our patients that this is not a free cleaning. It's a preventive cleaning that is included in the plan that you have worked so hard. Yes, it helps them make a decision for themselves and choosing what's best for them. 1,000,000%. Yeah, I completely agree. And similar, when someone has that need for periodontal therapy, there is it's the same as needing a cavity in all four quarters of your mouth, right? So that's such a simple explanation that has people understand. And, due to time, we did not get into the weeds, but we want to be able, as hygienists and assistants and doctors in the back office, to say, this is treatment now instead of prevention. So your insurance is going to look at this just like they do a cavity. So that means that you're going to have a deductible, which means how much you have to pay before the insurance will help, and then a copay, which is your portion of the treatment that we're going to provide. So it's super simple, right? I'm not giving any specific numbers. I'm not going into depth. I'm keeping it very, very simple. But then when we walk them up front to Aubrey, that's, you know, gonna give them their how-to, no one's surprised about how this is gonna go.
Yeah,
Okay, so one of
that's
the
great.
attendees says, if periodontal treatment is done, what was instruction done? Okay, okay, great question. As I knock my wall behind me over, what I have found in a couple of decades of care myself, and then also research of the last several decades for dentists and dental hygienists, is our speeches on brushing and flossing don't work.
Mm.
So when someone has gingivitis or periodontal disease, both, we're not talking about brushing and flossing. We want to pick one thing that the patient seems most interested in anti-inflammatory living, and you'll say something like this. Did you know that if you play the game Find the Veggie, then your gums will heal faster? And the patient's like, what's Find the Veggie? And you say, I'm so glad you asked. That's where you find something that was a plant recently and add it to every meal and snack that you have. So fruits, nuts, vegetables, anything that was a plant recently, you add it. And why does this work so well? Well, we know that if we can add something that was a plant recently, the patient is going to get more nutrients. In America, less than 10% of people are getting the amount of fruits and vegetables that they need in a day. So rather than shaming them and telling them to eat better and stop with the processed food and stop getting that cookie dough ice cream that you love so much, just say, oh, pick something that was a plant recently. And you guys now that are with us can all be aware that this makes such a big difference because now you're listening to me, right? You're ready for me to say about water pick or which was the best
Mm.
uh, power toothbrush. But now the conversation went in a completely different way. And so the patient's paying attention and we're paying attention, and it's making a much better effect on the patient. Now, two things. One, I say recently because I've raised four teenagers and they can tell you how a Twinkie was a plant. Zach, at one time, a Twinkie was a plant. So that you have to add recently to the bottom line on the back end. Ask me how I know. And then the second part is that our patients know. You if they've ever been to the dentist before, they have heard the floss and brush lecture. And adults in general know that if they brush and floss better, then they will have less periodontal disease. So by talking about vegetables, I took out the shame. I took out the Charlie Brown's teacher. I added something that was fun that will not only bless their oral health, but their cardiovascular, their metabolic, their autoimmune, you name it. Anything that they are working on, we just gave them a tiny little nugget that if they do nothing else, they eat crap all day, but add a plant that recently to every time they eat, it's going to blow all of their blood work and makeup out of the water so much better. And the best part, guess who's stopping at the grocery store on the way home to buy the power toothbrush that you didn't even mention? I've seen it over and over and over, and not just me. This isn't just, oh, I'm the hygienist and this is how my office does it. No, this is nationwide, more than a decade. I've watched people talk about, and it doesn't have to be vegetables. So, Zach, maybe the thing that is lacking for you is sleep. So, I might encourage you to do a couple of things to help you get more or better sleep. Going for a walk in the evening, movement after you've had a stressful day of work can actually alleviate jaw pain better than really most of the other things that we do in many of our patients, not all of them. Joy. I had a patient 2 weeks ago. She said, my gums are going to be bad today. And I was like, oh, Amy, what changed for you? She says, oh, my mental health. And you could just see that she was crestfallen. And she was ready for me to lecture her about how important it is for her to take care of her gums. She's got to brush and floss, even if she's sad. So I looked at her and I said, Amy, what brings you joy? And she just, what? And I said, yeah, what brings you joy? And she says, my dog. I said, okay, that's it. This is your homework. Are you ready? She's like, okay. 10 minutes with your dog. Take him outside, go around the block one time. Just joy. Every time you feel sad, you get overwhelmed with busyness at work, your job is joy. Well, pretty soon she's got her phone out and she's like, look at this. This dog's name was Mouse. He was a 220-pound English Mastiff Great Dane combo. I mean, this
Wow.
dog is two of me.
Yeah,
And he lit up, Zach, and just felt so seen and heard and loved and was so grateful that I didn't lecture her. And you know what? Her gums were worse. And I didn't say a word about brushing and flossing. But that girl left with her head and shoulders back and a smile on her face. And that was way more important than the lecture that I had from 20 years ago.
that's great. We have one more question.
Great.
This is from Mariana. Any input on treatment acceptance and patient retention to avoid cancellations?
Yes, Mariana, that is such a good question. And I'm really glad that you were here today and talking about all of this with us. What I have found is when we say, oh, we're so excited, you have an hour with Mariana tomorrow, then your patient is connecting the human to that appointment. Then, when your patient comes in and you've deleted the lecturing and you've linked arms with them, you've stopped using the dental lingo and you've really made everything that you're talking about accessible to them and looking at them as a whole instead of a whole, they feel committed to you. They want their appointment. They know that you're going to be booked out. So canceling appointment doesn't work very well. And then they're also going to tell their friends and family that the best place to get care is with you and your team. So everything that you can do from the touch point online to the telephone to when they come into the office that's personal is going to help you avoid cancellations. And in this digital age, we have the most lonely population that the world has ever seen. So, the way to remedy that is to very much connect with them as humans. And it's fun to watch this come to fruition because as people realize that they get that connection there, they'll be committed to you. And sometimes you're going to have cancellations no matter what you do. I have never seen a schedule look exactly the way it did at the beginning of the day to the end of the day, but you will thoroughly minimize them when that human connection is so much more present. And this is especially true when you're using any type of automated system, right? Our patients start to feel like a number. They start to feel like just one of the herd, one of the cattle. And so bringing it back to that emotional exchange is going to change how it happens for you. So great question.
Awesome. Well, it looks like that's the rest of the questions. Thank you so much, Brandy, for joining us. Great insights, so much energy. We loved it. So thank you so much. Um, and
Thanks
thank you
for
everyone
having me.
for coming. Oh, it was our pleasure. And thank
Yes,
you
thank you
everyone that came.
all. Have such a great night, and thank you for being on the team. It's really an honor. So take care, everyone.
Great. Thank you. Bye.